we all, I think, I'm not going to read everybody's questions. I can read probably 15 names off here of people who want to know this, and I think it's on everybody's mind. Why not single payer?
Let me answer that. Let me first just come back and echo. Let me first just come back and echo one point, which is, it is so vitally important that people like you in this room get involved in this. Because if it happens, it'll happen because there's a groundswell around the country that says we need this. And you've shown in the past how important groups like this can be. Now we have to do it again. Why not single payer? President Obama said something very early on in his presidential campaign, which people criticized him for, but he believed it, so he said it. What he said was that if we were starting the system over, of course we would do that. And that's what he said, and that's what he believes. Where we are now, the idea of change frightens a lot of people. And so it's very difficult to go to a lot of the country and say, we're going to have a radical transformation right off the bat. What the president wants to do is say, look, let's set in place the mechanism so that if people want that, they can have it. And if they don't, that's okay. So how did he do that? He said, I want there to be a public insurance option that's right alongside private insurance options. And people who are more comfortable with the public insurance plan, because that's what they like, should be able to go into that. All these Republicans who oppose it, why are you opposed to choice for people? Do you think people are not smart enough to decide what they want to do? So the fundamental part is that. Now it's also the case that politically there just would not be the votes for it at all. It's very clear it would go down to defeat. It wouldn't get more than a third of the Senate and probably an equivalent amount in the House. So what he said is, we need to get something done. We need to move forward in a way that doesn't threaten a lot of people who feel comfortable now. But let's set it up so that if that's the way things work best, that's where we'll wind up going.
So the public,
Thank you.
Is on the table,
The public option is very much on the table. And when the Republicans started pushing back on it, you saw a lot of pushback. You saw a lot of people saying, no, hold on, we're not going to give up on this so easily. We are not going to. Let's find a way that works. And again, it goes back to this issue about what's the right role of government, and can you find it? And what's interesting is the rhetoric has toned down a little bit on that as people have stopped and said, let's get rid of the label and start to think about what we really want people to have and whether there's a way to make it work. So far, many of the key Republicans, the ranking minority members of the key committees, have decided they want to participate and not fight. America's health insurance plans has decided they want to participate so far and not fight. The pharmaceutical industry, big employers, everyone so far is saying, I want to participate, I want to see if we can come together, I hope we can. That's what they're all saying now. A testament to the president.